Recovering a healthy heart, the best exercises after a heart attack, scientific and safe. Welcome to the US Health Guide. After a heart attack, life can feel like it's taken an unexpected turn, but the journey to recovery doesn't have to be a lonely one. Your heart can absolutely grow strong again, and the key lies in exercising the right way. This video will explore the scientifically proven best exercises to help your heart heal and enhance your overall quality of life. However, there's one crucial point you must remember. All information in this video is for general guidance only. Every individual's health journey is unique, especially after a cardiac event. Therefore, always consult your doctor or a cardiologist to get a personalized exercise plan that is safest and most effective for you. This is especially important if you've recently had a heart attack, are experiencing chest pain or shortness of breath, have diabetes, or have recently undergone a heart procedure or surgery. Your medical team's guidance ensures that all physical activities are perfectly tailored to your heart's specific capabilities and condition, minimizing risks and maximizing your recovery benefits. So why is exercise so vital after a heart attack? Science has shown that regular physical activity isn't just part of a healthy lifestyle. It's powerful medicine for your heart. Exercise helps your heart muscle become stronger and more resilient, allowing it to pump blood more efficiently throughout your body. When your heart is safely challenged through movement, it adapts and becomes stronger, improving its ability to deliver oxygen and nutrients to your organs, helping your body function more robustly without feeling overly tired. Not only that, but exercise also helps your heart build new arteries and capillaries, improving oxygen circulation throughout your body. The development of these new blood vessels can even create alternative blood flow pathways, helping to prevent future heart attacks by ensuring adequate blood supply to the heart muscle, even if there's a partial blockage. Exercise is also a powerful tool against the main risk factors for cardiovascular disease. It helps control and lower high blood pressure, reducing the strain on your heart. Regular workouts also help lower bad cholesterol, LDL, and raise good cholesterol, HDL, improving your blood lipid profile and reducing the risk of atherosclerosis. For those with diabetes, exercise improves insulin sensitivity, helping to regulate blood sugar more effectively. Furthermore, physical activity helps burn calories, maintain a healthy weight, and can even aid in controlling nicotine cravings, making it easier to quit smoking, one of the leading risk factors for blood vessel damage and heart disease. Finally, exercise is a natural antidote that helps reduce stress, anxiety, and depression, common emotional challenges after a heart attack. Physical activity improves sleep quality and brings a greater sense of relaxation and optimism. A healthy mind also indirectly helps prevent secondary heart attacks, as psychological factors can significantly impact cardiovascular health. Cardiac rehabilitation, your safe path to recovery. For the safest and most effective recovery, many patients are recommended to participate in a cardiac rehabilitation (CR) program. This isn't just about exercise, it's a comprehensive medical program, personalized and closely monitored by a multidisciplinary team of healthcare professionals, including doctors, nurses, exercise physiologists, nutritionists, and psychologists. The main goal of CR is to help patients recover physically and mentally after a cardiac event, improve their lifestyle, and prevent future recurrences. This program is often recommended for individuals who have experienced a heart attack, heart surgery, or have other stable cardiovascular conditions. CR is divided into progressive phases to ensure a safe and effective recovery. Phase 1, in-hospital phase. This phase begins immediately in the hospital, often in the cardiac care unit, once your condition is stable. The focus is on gentle exercises to increase your range of motion, prevent physical deconditioning from bed rest, and provide early education about risk factors and healthy lifestyle choices. Starting rehabilitation as early as possible is crucial, as delaying it can significantly prolong your recovery. Phase 2, supervised outpatient cardiac rehabilitation. Once you're stable and cleared by your cardiologist, this phase begins. This is the core of the program, typically lasting about 12 weeks, with a total of 36 supervised sessions, usually 3 sessions per week, each lasting about 60 minutes. The program includes endurance exercises like walking or cycling on a treadmill, resistance training, and aerobic exercises, along with nutritional counseling and psychological support to help you cope with emotional challenges. Phase 3, maintenance phase, at home/community. After completing the supervised program, you'll be guided to continue exercises at home. This phase focuses on increasing your independence and ability to self-monitor your long-term health. Regular follow-up appointments are still essential to track your progress and adjust your plan as needed. Participation in CR is considered the gold standard because it helps patients recover quickly, improves quality of life, reduces the risk of recurrent heart attacks, slows or even reverses atherosclerosis, and lowers the future mortality rate from heart disease. Suitable exercises to help your heart recover. Now that we understand the importance and the path of cardiac rehabilitation, let's delve into the specific types of exercises recommended. Variety in your workout routine will bring comprehensive benefits to your heart and body. Combining different types of exercises will help you develop endurance, strength, and flexibility in a balanced way. Aerobic cardio exercises. This group of exercises helps increase your heart rate and breathing using large muscle groups rhythmically. They improve your heart and lungs' ability to use oxygen, enhance cardiovascular endurance, and help your heart pump blood more efficiently. Common examples. Walking or brisk walking is often the first and most suitable exercise to start with, especially for individuals with heart conditions or older adults with joint issues. Even walking for just 5 to 10 minutes a day at a low intensity can reduce the risk of death from heart disease. Other options include cycling at home or outdoors, swimming, excellent for those with joint problems, light jogging, and even dancing. A large study linked moderate intensity dancing to a lower risk of early death from heart disease. Frequency duration recommendations. The American Heart Association, AHA, recommends at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week. Physical activities can be broken down into short bouts, lasting at least 10 minutes each. Strength training exercises. This group of exercises helps build and strengthen muscles, burn calories, improve bone density, joint function, and overall stamina. Building muscle helps burn calories faster, maintain a healthy metabolism, and improve cognitive function as you age. Examples: you can start with light weights, just 2 to 5 pounds, or use resistance bands. These are safe and effective options. Body weight exercises like push-ups and sit-ups are also very beneficial. For beginners, exercises like high knees, butt kicks, and crab walk are also suggested to strengthen core muscles and support cardiovascular health. Important note: avoid lifting excessively heavy weights, especially for individuals with heart conditions, as this can put too much strain on the heart. Frequency recommendations. Strength exercises should be performed 2 to 3 times per week, with 2 to 3 sets of 8 to 12 repetitions at 60 to 80% of your maximum capacity. Research shows that even less than 1 hour of weightlifting per week can reduce the risk of heart attack or stroke by 40 to 70%. Flexibility and balance exercises. These exercises help increase flexibility, improve balance, reduce the risk of falls, and are particularly important for stress reduction and mental well-being. They also help increase blood flow and lower blood pressure. Examples: yoga helps reduce stress and improve sleep quality. Tai Chi improves balance and mental health. Pilates and stretching exercises are excellent for relaxing muscles, improving blood circulation, aiding recovery, and reducing soreness after physical activity or exercise. Golden rules for safe exercise after a heart attack. Safety is paramount when exercising after a heart attack. Adhering to the following principles will help you maximize benefits and minimize risks, ensuring a smooth and effective recovery process. thorough warm-up and cool-down. Always dedicate 5 to 10 minutes to a gentle warm-up with exercises like walking, wrist and ankle rotations, and stretching before starting your main workout. This helps increase blood circulation to the muscles, warms up the body, and allows the heart and other systems to gradually adjust from rest to more intense activity, thereby reducing the risk of injury and sudden strain on the heart. After your workout, gradually slow down instead of stopping abruptly. Spend 10 to 15 minutes stretching to help relax muscles, improve blood circulation, and reduce soreness. Gradual progression. Listen to your body. Do not try to do too much too soon. You should start with small goals and gradually increase the intensity and duration of your workouts as your body adapts and gets used to it. The most important rule is to pay attention to your body's signals and stop exercising immediately if you feel any discomfort. The ability to recognize and respond to abnormal signs is key to ensuring safety. Control exercise intensity. Exercise intensity is a crucial factor determining safety for individuals with heart conditions. Over-exercising can increase the risk of stroke or heart attack. To exercise at a moderate intensity, you can refer to the target heart rate formula. Your estimated maximum heart rate is 220 minus your age. When exercising, your heart rate should stay between 50 to 70% of your estimated maximum heart rate. For example, if you are 60 years old, your estimated maximum heart rate would be 220 minus 60 equals 160 beats per minute. When exercising, your heart rate should stay between 80 and 112 beats per minute. Additionally, you can use the Borg rating of perceived exertion scale from 6 to 20 to gauge your subjective effort level. The goal is to feel somewhat hard to moderately hard, around 11 to 13 on the Borg scale. Using heart rate monitors like smartwatches to control your heart rate throughout your workout is very important. Consider environment, nutrition, and hydration. Avoid exercising in excessively hot, humid, above 80 degrees Fahrenheit, 27 Celsius, or overly cold weather conditions. Extreme environments can increase the strain on the cardiovascular system. If exercising in a gym, ensure the space is well ventilated and has adequate air conditioning. Do not exercise immediately after a large meal or when overly hungry. The ideal time to exercise is about 2 hours after a main meal. If exercising too far from a main meal, a small, appropriate snack before your workout is advisable. Ensure you drink enough water before, during, and after exercise to maintain electrolyte balance and protect cardiovascular health. Importance of regular medical follow-up. Before starting any exercise program, cardiac patients need to be thoroughly evaluated with methods such as an exercise electrocardiogram to determine the body's response to exertion, an echocardiogram to check heart function, and a 24 to 48-hour Holter ECG if there's a risk of arrhythmia. For high-risk groups, example severe heart failure, dangerous arrhythmias, exercise requires close medical supervision or at a specialized cardiac rehabilitation center. Warning signs: when to stop exercising immediately. During exercise, early recognition of abnormal signs is extremely important to protect your heart. It's crucial to distinguish between normal exercise fatigue and dangerous cardiovascular warning symptoms. You should stop exercising immediately and seek urgent medical attention if you experience any of the following warning signs. Chest pain or discomfort. This is the most common and important sign. The discomfort can be a dull ache, heaviness, pressure, or burning sensation in the breastbone area, possibly radiating to the neck, jaw, shoulders, arms, often the left arm, back, or abdomen. This pain is often sudden and increases in intensity. If the discomfort lasts longer than 1 minute, you should stop exercising immediately. Unusual shortness of breath, feeling breathless, difficulty breathing, or chest tightness that appears unusually during activity, especially if accompanied by severe chest pain and lasting longer than 10 minutes. Sudden dizziness or lightheadedness. While physical activity can cause fatigue, it should never cause dizziness or lightheadedness. This condition indicates that your cardiovascular system is experiencing problems, and exercise merely makes them more apparent. Abnormal heart rhythm. Feeling your heart beating unusually fast, palpitations, irregularly or too slowly for your exertion level. When touching your left chest, you might clearly feel your heart beating sometimes fast, sometimes slow. Unusual cold sweats and nausea. While sweating during exercise is normal, cold sweats, profuse sweating, accompanied by nausea or discomfort in the upper abdomen, heartburn, indigestion, can be a warning sign of a heart attack. The combination of these symptoms often signals an acute condition. Unusual fatigue, a sudden, severe feeling of fatigue disproportionate to the level of activity. This could be a sign of reduced cardiac output, meaning the body is not receiving enough oxygen. Instructions for handling warning signs. When any warning sign appears, time is the most critical factor in protecting your life and minimizing heart damage. You and those around you should take the following steps quickly and calmly. Stop exercising immediately. This is the top priority to reduce the burden on your heart. Find a flat surface and slowly sit or lie down. You should be in a semi-sitting, semi-reclining position in the nearest place with back or head support to relax. Stay calm and breathe gently. Try to maintain slow, steady breaths through your nose, avoiding deep breaths and holding your breath to limit muscle tension and heart strain. Immediately call 911. Do not hesitate. Calling for emergency services promptly can determine the outcome. Loosen clothing. Remove jackets, loosen ties, scarves, buttons, and belts to make the person more comfortable and breathe easier. Avoid driving. You should not operate any vehicle for at least 2 hours afterward, even if symptoms seem to have subsided. In summary, exercise is a crucial factor in recovering and maintaining a healthy heart after a heart attack. Regular physical activity not only helps strengthen the heart muscle and control risk factors like blood pressure, cholesterol, and blood sugar, but also significantly improves your mental well-being. Always remember that safety must come first. Exercise needs to be personalized and conducted under the guidance of healthcare professionals, especially through supervised cardiac rehabilitation programs. Always proactively consult your doctor or cardiologist to get an exercise program tailored to your specific health condition. Thorough warm-ups, gradual progression, listening to your body, and recognizing warning signs are indispensable principles to ensure safety. Consistency and regularity in exercise, along with maintaining a comprehensive, healthy lifestyle, including proper nutrition and adequate hydration, are the keys to a sustainably healthy heart. Your heart deserves the best care to maintain an active and quality life. If you found this video from the US Health Guide helpful, please like, share, and subscribe to our channel so you don't miss out on other important health information. Thank you for watching.